Hello dear students, we are glad to see you again, and here again it's about urological tumors and benign and malignant neoplasms. Firstly, about background. This branch of medicine is well connected with such sciences as oncology, urology, andrology, and gynecology. Oncourology is a branch of medicine which deals with studying etiology and pathogenesis, treating and preventing benign and malignant tumors of the urogenital system. Here you can see brief information about anatomical structure and different appearance in our organism according to their localization. Here you can see these ones according to the male or female organism, and you should refresh your knowledge from anatomy, pathomorphology, histology, and other courses you've had before. Objects of studying. Firstly, it's a prostate cancer. Number 1 in males. It's very dangerous state, and you can see different stages here. This cancer localization and appearing in different structures near this organ. Also, it's renal cell carcinoma of parenchyma of kidney. It may be transitional cell carcinoma of the pelvis, ureter, and bladder. Non- or germogenic tumors of the testes and paratesticular tissues in males. Tumors of the seminal vesicles, tumors of the urethra and penis. So remember that you can deal with them with your patient during your practical time. Firstly, about kidney cancer, we can start our presentation from the top to the downwards of the urinary tract of human organism. Kidney cancer or renal cell carcinoma. Renal cell carcinoma occurs when cancer cells start growing uncontrollably in the lining of the tubules of the kidney, or are the structures of the parenchyma. Renal cell carcinoma is a fast-growing cancer and often spreads to the lungs and surrounding organs. These metastases are very dangerous and should be controlled by specialists. Here you can see the size of tumor according to the stage, from first to the fourth. Sometimes tumor can be as large as you can't even imagine, so the kidney should be removed. And statistics. 3% from all oncologic diseases are kidney cancer. 2050, 50,000 fall ill every day. Here you can see these points about deaths and 5-year-old survivability. Remember about that in your practice. Leading factors that can cause renal cell carcinoma are smoking. Risk increases from 30 to 60%. Remember about that. Diuretics and dialysis can cause appearing this situation too. Arterial hypertension in people who suffer from this is very important too. Polycystic kidney disease, PKD, damages different structures and can cause secondary damage of such as a tumor. Intake of analgesics which contain phenacetin. So, as I said before in previous lectures, not all drugs can cause only benefits of treating, but contra administrations you should remember too, because complications are dangerous. Hereditary gene disorders, for example, syndrome of von Hippel-Lindau, can be seen too. Obesity, diabetes, and problems with ecological state and males are more sustainable to have such problem as a tumor. As I said before, von Hippel-Lindau syndrome is dangerous, but not everybody knows about that. Some words about it. It's embryonic mutation of the VHL gene in the third pair of chromosomes. In normal state, people have an adaptation of the cell to hypoxia and an inhibition of the tumor growth. But if this gene is deleted, cellular accumulation of factor leads to hypoxia, hypersecretion of vascular and endothelial growth factors, erythropoietin, hemangioblastomas, so tumor grows faster. Systems affected by these diseases. Such organs as brain, eyes, ears, and other ones can be affected and damaged. Firstly, about benign tumors. We should know some of them from the course of pathomorphology. Firstly, is fibroma, is a tumor located on the surface of the kidney or in its medulla. Such points are size, shape, color, and consistency should be known by you. This tumor is poorly symptomatic and can be detected only after screening, so less symptoms, less chance to detect it. Here you can see the incision of the kidney, and this neoplasia is fibroma. Hemangioma is a tumor located under the capsula of kidney, most commonly, or kidney papilla. Here you can see the cavernous hemangioma of the kidney. Such points you should remember: also size, shape, color, and consistency. This reddish tumor you can see obviously, but easily injured and bleeds. For example, you have a patient who doesn't suffer from any symptoms of tumor, but has side effects and has an operation, and if kidney is injured, so the risk of bleeding and lethal result of the operation is more high and enhanced, according to appearing of hemangioma. Another one is adenoma, is a tumor located under the fibrous capsule of the kidney, on the surface of the kidney, or in its medulla. It appears from the glands, which are also present in parenchyma of kidney, and also little symptomatic. Here you can see the adenoma of kidney of the upper part of it, and also a little symptomatic as a fibroma. Size, shape, color, and consistency may be various, and color is typically whitish or gray. Lymphangioma is a multiple tumor which grows from vessels which flow lymph. It's cavernous tumor about 2 or 3 centimeters, and dermoid sized of the kidney are rarely occurred, and they consist in usual tissues. For example, it's teeth or hair, and sizes can be also different. As we know, in gynecology, dermoid size of ovaries are well commonly spread, and such tumors in kidney can be present too. Remember about that. Here you can see main symptoms which can be present in people who suffer from tumor, even if they don't know about that. It may be fever, but not every time, only if it's secondary infection. Swollen lymph nodes, it may be well swollen if it's metastasis already. Fatigue, trouble breathing, pain on the side of body or back which is affected by tumor, appetite loss, weight loss, blood in the urine, it's damaging the structures of kidney, swelling around the left testicle in men, and bone pain. Also, more of them are most commonly if metastasis already present. And the next one is histology and paramorphology, part of malignant tumors classification. Here you can see clear normal cell, papillary type 2, chromophobe, oncocytoma. Here is a tumor. These malignant tumors also called Gravit's tumors. Histologically, we can detect different kinds of tumors. Light cellular, you can see percentage, chromophilic, chromophobic, oncocytoma, collective tube cancer, mucinous tubular, and spindle cell carcinoma. Renal cell carcinoma associated with neuroblastoma, medullary carcinoma, an unclassified tumor. Here you can see collecting ducts affected by tumor and medullary